Very good afternoon to everyone. Thank you so much for coming, making time to join our panel today. My name is Srujit Lingala. I'm the Director for Business Solutions at Sight and Life. Today's panel is Saving Lives and Livelihoods, one egg hub at a time. I would like to kick off this session by inviting Dr. Abeba Aile to start with the opening remarks.
Thank you so much, Srujit. Good afternoon, everyone. Very happy to be here with all of you to talk about eggs, a bit different from what we've been talking so far. So as we all know, food insecurity and malnutrition continue to be pressing concerns in the world, seriously exacerbated by the poly crisis, as we know, climate conflict and economic shocks. At midpoint for SDGs, indications are that we'll not be able to achieve the food and agriculture-related SDGs. Estimates are staggering, as you know. 30% of the global population is food insecure. And as we all know, women and children are disproportionately affected. And unfortunately, women malnutrition means a beginning of the cycle for intergenerational malnutrition and reduced human capital that's difficult to break. Addressing this huge challenge we're facing requires a wide range of interventions across multiple sectors within the food system lens. And in a world grappling with this multiple crisis, we need to have practical and transformative actions to enhance and scale up access to malnutrition to the most vulnerable, women and children. So our panel today will specifically focus on one of the strategies to improve quality and diversity of diet for children and pregnant and lactating women. And in the next 90 minutes, you will be immersed in a diverse spectrum of insights about eggs. Our panel comprises of scientists, thought leaders, funders, practitioners, and marketers, making it truly one of a kind of a panel. So a scientist will discuss how eggs impact the growth of Peruvian children. A marketer from Malawi will share their strategies in encouraging thousands of women and children to include eggs in their diets. We'll also explore an innovative business model that empowers smallholder farmers to produce quality fresh eggs for their communities. We'll hear from policymakers as well on their thoughts on eggs. So in short, we'll talk about the power of eggs. And without further ado, I'd like to pass this to Srujit to introduce the panelists. Thank you.
Thank you so much, Dr. Abeba, for giving us an insight into what we can expect in the next 90 minutes. One word Dr. Abeba said I wanted to delve into is one-of-a-kind panel. It's a one-time opportunity, so please feel free to ask as many questions to the presenters and the panelists. Let's make it an engaging and interactive session. And with that, I would like to invite Dr. Nelly Zavaleta Pimentel. She's a senior investigator at the Instituto de Investigación Nutricional, Peru. And she's going to talk about the evidence and impact from community-based trial on consumption of eggs among older infants and young children in Peru. Dr. Nelly, please come.
Greetings to everyone. I am very delighted to be here in this session. I will present the result of a project related to including in the complementary feeding and its effect on growth velocity and motor development in Peruvian infants. Before I start, I would like to acknowledge to my team and colleagues in Lima, Peru, and also to Sight and Life Foundation for their support to this study. Growth faltering is a common problem in many developing countries and low and middle-income countries in the world. And adequate nutrition is very important to sustain adequate growth in children. Eggs are a very nutritious food that has many nutrients like good quality protein, fatty acids, choline, zinc, and other nutrients. So, including eggs in complementary feeding has demonstrated benefits on growth velocity in many countries. However, the evaluation of this study has been in children with moderate or severe malnutrition. In this study, we are going to see the effect in a population that has some degree of growth faltering, but not yet have stunting. So we are looking at the possibilities to prevent stunting. And also we are measuring this effect not only in growth velocity, but also in development in the different domains. The study was conducted in Lima, Peru, in Villa El Salvador, a district that is located in the south skirts of Lima, and we evaluated 244 children from 6 to 11 months of age, divided into groups, the intervention 122 children, and the same number for the control groups. The study lasted for 6 months, and also we have evaluated anthropometry, length and weight, and head circumferences, and also evaluated dietary intake, biochemical indicator as hemoglobin and iron status, and also inflammatory biomarkers. And also we measure development in the different domains using the age and stages scale. You have some picture here of the study. As you can see, we have the nutritionist doing the dietary evaluation, and also she did the counseling to mothers of the children. And you have the nurses that she did the development evaluation and interacting with the mother and the child, and also the sample collection for the study. And also you see some figures of the evaluation of the anthropometry, and also we did the clinical evaluation of these children at the entry and at the end of the trial. As you can see, the intervention, we gave to the family a package of 15 eggs with the instructions to give a child 1 egg per day. So every week we gave to the family 1 package of these eggs. And we had also made home visits every 2 weeks to measure morbidity and also egg consumption and any other health problem that the child might have. If the child has a problem, we refer the child to the local health center. Here in the results, as you can see, we have at the beginning of the trial no differences in the Z-score of length for age, but at 3 months and also at 6 months, we see an improvement in linear growth velocity and a difference in the Z-scores of length per age in the intervention group, which is significant. So for those who are not familiar, the Z-score in length per age is the standard deviation toward from the mean. So you can, and this is negative. You can see the 0 upstairs. But they were significant at the 6 months of age. So, related to development, you can see here at the beginning of the trial, no differences in motor development, in gross motor development in children. And at the end of the study, we see an increase in both groups, but there were significant differences among the children who received the eggs. In conclusion, we have seen that inclusion of eggs into complementary feeding had a positive effect on growth velocity and motor development. Prevention of malnutrition, prevention of stunting through an improvement in the diet qualities through the consumption of eggs is a big possibility. And also to prevent stunting, And also we see here that preventing malnutrition also and also improving development, we also improve the economical potential of these individuals through the entire life and the risk of health diseases like non-communicable diseases. So thank you very much. There is a question? Excuse me. The study was conducted sorry, I can't see it. The study was conducted, yes, please. So because of the light, I can see.
If the study was conducted for a longer period of time, would we have seen more positive effects in the control in the intervention group and help them get back on track?
The study was conducted for a period of 6 months of age, which has been demonstrated that is enough to see a positive impact. However, we expect, as you can see, a difference between the two groups, that in the long term, the benefit in the intervention group might be higher. There is another question?
Thanks for the presentation. My question is about during this 6 months period, because the feeding of young children may change. Do you have, by your experience, how families were preparing it, and did it change through, and how was the adherence and the acceptability of this intervention by the family? Thank you.
Okay, thank you. Yes, egg is a very well-consumed food. It's a very common food. And the mothers were instructed by the nutritionist how to prepare in different recipes, but I must say that the most common food was boiled eggs. The most common recipe was boiled eggs. And they consumed more than 95% of the days, of the intervention days. So I don't have exactly that. And the mother recorded every day in a figure the exact amount, she painted the amount of the egg that the child has consumed. So at the paper we will estimate the amount of egg that the child has consumed during the study.
My name is Ngozi Nam from University of Nigeria, Nsukka, and the President, Federation of African Nutrition Societies. I'm really impressed by this study and the impact it made on children 6 to 11 months. But my worry is, you've done the study and we've seen that it made a lot of impact, improved growth, velocity, and development. My worry and concern is, how have you built the capacity of these mothers, now that the study is over, for them to continue so that the gains already made will be sustained? What are you doing to build their capacity so that they will continue taking 1 egg a day to sustain gains already made? Thank you. Thank you.
Egg is a common food in the markets in Lima, and it's among the animal food sources one of the most economic food. And also there are other interventions in the area that promote women's organization and community kitchens to organize and produce eggs to make more affordable to the families. So they will talk of that later.
Thank you so much. Interesting result. My name is Saifu from Addis Ababa University, Ethiopia. So these egg interventions are producing conflicting results. I'm happy that this result produced some change in growth velocity. So the one research showed good result. The study in Malawi showed, no significant improvement. And the authors indicated that it's maybe due to the animal source consumption in Malawi. So how do you really evaluate the diet of these children, you have studied?
Yeah, we have many studies in Peru, and the main problem of the children at this age is the quality of the diet. So they do not have enough intake of vitamins and mineral and fatty acids. So the food improve the quality of the complementary meal. So this is how it contributed. And after the pandemic also, the capacity to buy meals rich in these nutrients also have diminished. So this will provide a non-expensive food that is accessible to the family to complement the diet. Okay, thank you. Thank you very much.
Thank you, Nelly, for that great presentation. My name is Srujit again, and I would like to talk to you about an innovative business model today that is providing eggs in emerging economies in a way that is affordable and accessible. Eggs are a powerhouse of nutrition. And like Dr. Nelly said and Dr. Abeba has said, it's really fascinating how nature has packed so many essential micronutrients, proteins into an egg that is so small, so well packaged. And what's more, children absolutely love it. I'll actually share a very small anecdote. I have very fond memories of me as a child running in my grandmother's backyard, waiting with extreme patience to collect eggs from the backyard chickens. At that time, it was so scarce and so precious that we used to take them carefully to my grandmother, who used to then make yummy Indian egg curries. But then, since then, India has come a long way. Back then, egg production was predominantly backyard. Now, India is the third largest producer of eggs. However, in many low and middle income countries, the problem still continues. That is because the dominant egg production model is still a backyard model, which is where a rural household usually has about 10 to 15 chickens foraging, and that's resulting in quite high mortality, low productivity, and in fact, it is actually posing greater health risks for the children, because there is growing evidence that is showing that children who are coming in contact with the feces are consuming them, leading to health risks, EED, and also stunting as well. So business as usual is definitely not going to solve this problem. And that's when Sight and Life, back in 2016, started by designing a pilot. And we've done about 160 interviews in Kenya, Ethiopia, and Malawi with various different stakeholders. And what we've identified, if we've been able to synthesize all our learnings, it's that smallholder farmers are plagued with several challenges that are not enabling them to move and expand their poultry farms. They are having low productivity because the quality of the birds is low, the vaccines are not there, the feed is not there, and when required, they don't have the extension services. And they also have limited access to markets and credit as well, and there's very high transportation costs, so eggs cannot go beyond a certain distance. And we've also been able to look at and study 5 different egg production models, which is the micro-franchising model, the microfinancing model, the cooperative model, the hub model, and the outgrower model. The micro-franchising and the microfinancing, the first two models that you see on the slide, are improvements in the backyard production model. The size of the birds is about moving from 10 birds to about 15 to 50 birds approximately. The cooperative model is where the birds are about 500 to 600 birds, and where you really start seeing improvements in productivity, improvements in the quality of the bird, improvements in the feed that the bird is consuming is the hub and the outgrower model, where the birds are about 1,000 to above 1,000, about 5,000 in the outgrower, 1,000 to 1,200 in the hub model. And in both of these models, you will also see that the farmer is having better income that is really enabling and incentivizing them to move towards the hub and the outgrower model. And with this understanding, and between the hub and the outgrower model, we've chosen to do the hub model because the hub model really is a vehicle and a tool for us to increase egg production in the communities. The outgrower model, which is about 5,000 birds, is more of a model that is suitable to urban and peri-urban contexts, but we wanted to go to the rural communities and provide that egg availability to the rural communities. And what you see on the screen is the EggHub model. If I have to summarize the EggHub model in one word, it is aggregation. Aggregation of inputs and providing them to the farmer, aggregation of extension services, providing training, and by aggregating all of the inputs in terms of the birds, in terms of the feed, we are able to also achieve economies of scale for the farmer as well. And this model works in a way that we work with smallholder backyard farmers and transition them into smallholder farmers who are achieving economies of scale. We work in this case with an EggHub entrepreneur whom you will meet very shortly in our panel. The EggHub entrepreneur is usually a feed miller because 70% of the cost of an egg comes from the feed. It is the feed miller who's really suited to continue and take this model forward. In this model, like you see, the EggHub operator has a feed mill. They are able to grow the birds to 18 weeks. They also have a training center and a demo farm with which they can train the farmers. Then all of these inputs go to the farmer and at their doorstep. So the farmer doesn't, all of the problems that you saw in the earlier slide where they're not able to get the inputs, not able to get high quality feed, all of them are solved because there is somebody who's providing all of these inputs to the farmer. The farmer then collects the chickens, distributes it into the retail centers within the community, and the community then consumes them. And this model is unique and innovative in a sense that after the initial investment into the model is able to sustain itself without any further philanthropic investments into the EggHub. And the reason behind that is because there is incentives created across the value chain, be it for the farmers. The farmer is increasing his productivity. The bird mortality is coming down from 60% in the backyard production models to 3% in the EggHub model. The production of the eggs is increasing quite drastically. The income is increasing. He's able to make 3 times his income. Even consumers are able to consume more eggs and their affordability has increased. So the price of the eggs, in fact, has come down by 40%. And the EggHub operator, the entrepreneur in this case, is also able to make money. And since everybody is incentivized, this model is being sustainable. Like I said, farmers are able to make 3 times their daily income. The communities are having 3 times more eggs, and the eggs are available at 40% lower price than before. We've replicated the EggHub model in Peru and Brazil successfully during the pandemic and are now replicating it in Ethiopia. And in the upcoming panel, you will see the EggHub model in Ethiopia being talked about quite a bit, so stay tuned for that. And I'd like to end my presentation with another small story. the lady that you see here is our star. Her name is Grace. She came to us. She was the first. She was a part of the first farmer cohort. Started with about 800 birds. Now she has expanded her farm to 3 times. Now she has 2,500 birds. She's making 3 times the income. She's able to put her children through school as well. And it's not just one farmer. There are many farmers in our Egg Hub who are able to do this and continue to increase their income and also provide eggs for their communities. That's about the Egg Hub model. I'll stop here and see if you have any more questions. Thank you. If no more questions at this stage, I'll ask Dr. Patrizia to come over, please.
Thank you. I had a question, but I will wait for after. Okay, thank you so much for the opportunity of presenting. So I would like to really thank all the team that has been part of this presentation, because actually the findings are coming from 2 studies that are part of a comprehensive assessment on the role of livestock for food security, nutrition and diets. So here I'm presenting the findings for the first document, and I will present very preliminary finding on the second one. So this figure shows that there is a wide disparity of national food supplies, including egg. When it comes to the specifics of the egg, a person in South Sudan has a per capita supply of 20 grams, so less than 1 egg, while a person in Hong Kong accesses 25 kilograms a year, or over 500 eggs. So you can see already the huge disparity. If we look at the actual consumption based on the data from UNICEF on the consumption among children between 6 and 23 months, we see that, again, there is a disparity between the poorest and the wealthiest quintile. And these are data mostly from low and middle income countries. Now, on the study that I just mentioned, so we used methods for assessing the effect of terrestrial animal source food in terms of health benefits and risk following the PRISMA guidelines. And the terrestrial animal source food include all type of animal-derived food, excluding aquatic food and including egg. In terms of evidence, in terms of benefit, the evidence suggests that among all women of reproductive age, in any context, 2 eggs per day can provide high proportion of recommended nutrient intake, particularly for choline, selenium, and vitamin B12. However, the evidence on child nutritional outcome suggests that the benefits are specific in certain contexts. So also mentioning what one of the previous persons said. So highlighting the importance of considering the overall child diet and other contextual factors that affect child growth and development. In terms of the risk, the evidence on consumption of eggs on blood cholesterol in association with coronary heart diseases, stroke, and hypertension in healthy adults is not significant. And there is also no evidence that avoiding eggs during infancy can delay or prevent hypersensitivity or allergic reactions. We also did a review on recommendation on consumptions, looking at all policy documents, and in particular food-based dietary guideline. And some of the key findings are that most recommendations still look at all terrestrial animal source food in general without providing a recommendation tailored to specific types of terrestrial animal source food, such as egg. Most recommendations are looking at the link with human micronutrient needs and prevention of NCD, but are often targeted at the entire population. And in addition, we found that the majority of recommendations are still qualitative, although the new food-based dietary guidelines are much more quantitative and detailed in the type of recommendation, including specific recommendation by age group. So here I'm going to present some preliminary finding on the second report that we are producing on the food environment dimension affecting the supply and demand of terrestrial animal source food, including eggs. So in terms for this study, we looked at the 8 dimensions of the food environment using the conceptual framework of Turner et al. So this framework looks at 4 dimensions that are part of the external domain, which include availability, price, vendor and product properties, as well as market and regulation, as well as the dimension within the personal domain, such as accessibility, affordability, convenience, and desirability. We used a scoping review, so it was not a systematic review like it was done for the first document, so it was more exploratory in nature. But these are some of the preliminary findings as the report is not yet published. So most of the evidence is concentrated in high-income countries and also in North America, with significantly less study in low-income countries. And most of the available evidence is on milk and dairy products, followed by all types of meat, with a focus on availability, price, and affordability. However, when it comes to the evidence on the eggs, we found that there were only 6 studies looking at elasticities for price and income. And in terms of elasticities for price and income, the results were mixed. Because, again, it depended very much on how much the egg is part of the, let's say, the food basket, the common food basket of the population. There were also studies that looked at small-scale egg production, mostly for own consumption, with mixed results in terms of the nutrition outcome. But there were no studies that looked at purchase of eggs from the market. So again, this is a gap. And the third dimension most studied was, after availability and price affordability, was desirability. And there are many studies on desirability which are really very insightful and with a good geographic distribution, so really available from countries from all income categories. And there were also studies on gender dynamics of livestock management and ownership, showing that selling of eggs is in the hand of women when it comes to decisions associated to income generation, consumption, and also really looking within the family who should get the eggs. However, there have been not many studies that look how this changes with the change of the model. So if it goes from a small-scale production to a larger production. The terrestrial animal source food were seldom included in social protection studies, including for eggs. And if there are studies, they are more looking at the availability of milk and dairy within the school food environment. So future research is really needed in terms of the science when it comes to the food environment. We also looked at the policy and the regulatory landscape across all countries, looking at all types of policy and legislative document, including the same word search as for the evidence, so for the study review. So really looking at both the domain, the external domain and the personal domain, and including all types of terrestrial animal source food. And again, what we found was that the majority of the legislative documents were focusing on the regulatory and marketing aspect. But in low and lower middle income countries, there was significant attention paid on the availability. While we can see that in high income and upper middle income, there is much more on the marketing and regulation, as well as the vendor and product properties. And sometimes let's say the legislative documents address both sides. There were only 4 legislative documents, policy and legislative documents on affordability out of 574 documents reviewed. So it really shows that it's quite limited in terms of policy coverage. So I'm not going to go through this, but you can see that eggs was analyzed in policy document in relation to prices, vendor and product properties, and significantly less marketing and regulation, because it kind of attracts less attention compared with other types of animal source food. And finally, in terms of preliminary finding on the coherence between research and policy, we found that while there is a lot of evidence on desirability and what constitutes desirability in a given country, none of this is reflected in the policy document. And the same in terms of accessibility, there is limited studies that really look at accessibility, and the issues around accessibility are almost not covered in policy and legislative document. And this is for the terrestrial animal source food, but even more so when it comes to eggs, because it's already less covered than other types of animal source food. Thank you.
Thank you, Dr. Patrizia. We can start the panel session. I'd like to invite the panelists to please join me on the table. Dr. Patrizia Fracassi, please join me on the panel. Dr. Patrizia Fracassi is the Senior Nutrition and Food Systems Officer at the FAO. We have Dr. Sisay Sinamo, who is the Senior Program Manager at the Secota Declaration Federal Program Delivery Unit at the Ministry of Health. Maya Stewart, who is the Co-Founder and Director of Lenzimil and Yellow. Yetnaet Girma, who is the Director, Programs and Agri-Food Sector Lead at SNV. And Tariq Taye Birhanu, He is the manager, Child Health and Development, Children's Investment Fund Foundation. Thank you so much for joining me on the panel. I'd like to start the panel discussion today with Dr. Sise. Dr. Sise, the Secota Declaration, which you are leading, is government of Ethiopia's commitment to end child undernutrition by 2030. Can you please elaborate on what the efforts are undertaken by the Ministry of Health in this direction and how eggs tie into the Secota Declaration?
Yeah, thank you so much. I will give you a little bit background on what the Secota Declaration is and also how we have engaged in terms of egg production and consumption promotion, and also what is the impact to look like. So the Secota Declaration is the Ethiopian government commitment for ending stunting by the year 2030. It is a 15 years roadmap divided into 3 phases. We have completed the innovation phase in 2020 and in 40 waradas, and based on the evidence, the government has now scaled up into 240 districts across the country, covering over 2 million children under 2 and also over 1 million pregnant lactating mothers. 14 sector ministries are working together in nutrition sensitive, specific and nutrition smart interventions, and specifically Ministry of Agriculture and Ministry of Education are the ones that are heavily involved in poultry production and egg consumption. So when we come specifically in terms of how we are promoting egg into our program is the poultry production and egg consumption through Ministry of Agriculture and also Ministry of Education is promoted at household and also school level respectively. So specifically for schools, we have what we call it model nutrition schools. The model nutrition school is, the idea is schools engage in cow and or poultry production and vegetable production so that they can enrich the school meal using the produce they also produce at their respective schools. So based on our experience during the innovation phase, we found that model nutrition schools are successful interventions for sustainably providing access to egg and also enriching the school feeding program. So currently we have over 2 million children have been school-age children participating in school feeding program, but a large number of schools among them are also engaged into model nutrition schools where they also produce egg and also produce poultry for egg consumption. And in my recent visit to the Secota Declaration waradas, I found that the schools have their sheds and also they have also the poultry production, and the teachers are managing both the production as well as also the school feeding program to enrich the school meal with eggs produced from the poultry production farmers. And finally, in terms of the impact, we have done the impact of the first phase of the Secota Declaration jointly with Johns Hopkins University, and we have found that a 3% annual rate of reduction of stunting has been demonstrated, and based on the evidence, 90% of the impact has been achieved through improved complementary feeding interventions that has been achieved through nutrient-dense food production. So one of which is an egg, which has really contributed for the stunting reduction, which we have managed to avert over 110 children from stunting. Thank you.
Great, Dr. Sise, thank you so much. That's a fascinating insight into how a policy has really rolled out on the field, and how it was fascinating for me that teachers are looking at both school feeding but also production of eggs, and that's really great. Dr. Patrizia, you mentioned and talked about the need for more evidence on eggs and it needing to be a part of policy and legislation. What kind of evidence then is required, and how do you see this supporting programs like the Secota Declaration and the EggHub?
Yeah, thank you so much. Yeah, I mean, it's really great because in Ethiopia we have a new food-based dietary guideline, which in fact provides very good recommendation, and that at the same time, so that one has been able also to, in a way, to influence the policy. And then example of programs where there has been a good coordination between sectors. So for sure that's a very inspiring case study that can be used for other countries to bring together the evidence and the policy. At the moment, though, I mean, as I just mentioned, there is not this convergence between the science and the policy. So there needs to be more studies like the one that was presented before on the impact, as well as model that can be feasible. And the reason why the Hague model was of interest for us in FAO is really around the word that you used, that in terms of aggregation, because a lot of the current support is still looking at the household and the homestead production. So it will be very difficult to change that model overnight, but if you can support the aggregation and the coordination and show that it can be done in a sustainable way, like with the Hague model, I think you have both the science on the impact, the operational evidence on a type of model that is both more effective but also sustainable in the long term, and a way to influence the policy, because of most importance for the policy is that they can also influence the program and the investment, because what I understand in the Ethiopia case is that there has been also an investment to really support the egg production and the consumption, which is something that, yes, we are not finding in other countries. So my follow-up question would be, how much would be the domestic investment on that? But I pause here.
Okay, we'll get to that
you.
in a short bit. Dr. Patrizia, you mentioned coordination and aggregation as being very important, and that takes me to Tariq and Yetnayet. Tariq and Yetnayet have, along with Sight and Life, been implementing the EggHub in Malawi. Tariq, your support really in implementing the EggHub has been extraordinary, and thanks to that, the first EggHub in Ethiopia is up and running. Tell me, what are your two biggest learnings in this whole process?
Thank you, Srujit. Good afternoon, everyone. So at the Children's Investment Fund Foundation, for the past few years, we've been trying to explore strategies that could improve production and consumption of eggs, given the existing evidence. And I'm also freshly inspired by what we saw from Peru earlier. And with this in mind, with SNV, Insight in Life, and together with the government of Ethiopia, we've started the EggHub project in Ethiopia. So with this, for the past 1 year, we've documented plenty of lessons from our experience. But if you ask me to only pick two, I would say one is the importance of having a strategic partnership between government, non-profit, and the private sector. So Ethiopia, in terms of consumption of eggs, has one of the lowest egg consumption per capita in the world. And to sustainably transform the egg value chain and improve on consumption, a market-based approach is really needed. So with this in mind, we had initial consultations with the government, mainly with the Ministry of Health and the Ministry of Agriculture, on how to shape the enabling environment and later on how to translate that into policy. And then we had discussions with SNV to leverage on their wisdom and experience from decades of experience with working with smallholder farmers and also all the value chain actors. And of course, with Sight in Life because of the innovation in their expertise. And then we had to pull in an entrepreneur as well because of the sustainability issue embedded in the program. So having all these partners together was really important. And I can tell you it was not an easy job, but the results are rewarding. So far, the first egg hub was established in the first set of affiliated farms. We're also up and running, and we've seen results in terms of increased production of eggs, and we're looking forward to document further lessons in the coming year in relation to consumption. So this is mainly one of the important lessons, and I would say the second one could be allocating adequate resource and time for learning, because different models play out differently in different settings, and the EggHub is no exception. So I think what worked in Malawi, I mean, the settings are similar, but also there are basic differences between Ethiopia and Malawi. So that required to have some contextualization in place. So we actually allocated 2 to 3 years for the partners to adequately learn from the initial phase, which actually paid off because that gave the opportunity for the partners to contextualize the model first and test different pieces, see what worked, what did not work, run multiple iterations, and then finally to come up with a fit-for-context model, which you can basically take it up to scale. So far, we've also documented that in terms of production, and we're really looking forward for the consumption side of the learnings. So in summary, I would say the two important lessons are the importance of strategically pooling the government, the non-profit and public sector, and also the private sector, and the allocation of adequate time and resource for learning. Thank you.
Excellent. Thank you so much. I hear 3 P's there: partnership, planning, and perseverance. Perseverance, making sure that even if you fail, you plan ahead and then you forge forward. Thank you so much, Tariq. Yetnayat, it's a good time to bring you in. SNV has been in operation in Ethiopia for decades now. What has been unique in that partnership that you've had with Sight and Life and SIF to implement the EggHub, and what would you say is working well for this partnership? I wanted to ask that question because Tariq has talked about partnership. What really is working well about this partnership?
Good afternoon, everyone. Thank you, Surjit. Yes, you are right. SNV has been operational in Ethiopia since 1974. We have been focusing on 3 interrelated sectors: agri-food, energy, water, which are basic, for any human being, and to address or to contribute to addressing the nutritional, food, and livelihood security of the communities that we are working together. In the agri-food system, we are using a market-based approach to support the small-scale producers as well as the private sector to improve productivity, quality, so that the availability of nutritious food will increase locally. With this EggHub model, implementing partnering with SIF and SAL, it has created an opportunity, to leverage on the SNV's local knowledge and expertise, bringing in, SAL's tested innovation model of the EggHub to address nutrition problem in food insecure areas. Coming to the unique aspect of this partnership, I would say there are 2 elements I would like to share. In Ethiopia, I think this is the first time through a business partnership we were able to transform the small-scale producers into a commercially and nutrition-sensitive egg production for local consumption. So the local consumption is very important here at this scale. And the other one is SNV is now working both on the consumption and the production side to address the nutrition security of women and children. These are the two aspects, unique aspects I can share at this moment. In terms of what worked so far, you know, we just started the second year, so in terms of results, we are not yet there, but we have seen very positive elements. One of it is, you know, we are focusing on egg, one product which is relatively easily accessible, you know, to everyone, to poor households. It's all about, you know, leaving no one behind. This is very important, and as a project also we are working to further improve the efficiency so that eggs can become, you know, more affordable to all. The second element is the private sector is, you know, the driving force in this process to ensure sustainable supply of, you know, nutritious food, egg in this project. So it's identifying the right private sector with the right incentive so that, you know, this supply of egg will continue beyond the project period. Sustainability is very important. It shouldn't be, you know, project-driven initiative. And the third one is, you know, the collaboration among, you know, the different actors, CIF, SAL, and SNV. SNV with the local knowledge and expertise in the market-based approach. SAL providing the technical assistance based on the learnings, you know, some in other EggHub operations, and also the constant support coming from CIF was helpful, you know, in terms of rolling out and reaching to this level. Finally, consumer awareness is very important. It's not about increasing production, particularly when you move to commercialization. Usually there is a tendency, you know, to take out the produce outside the producer's area. So, but this project is specifically focusing on the local consumption, improving the nutritional status of women and children in the locality. So these are, you know, the 4 takeaways.
Thank you so much, Yetnad. You raise a very interesting point, consumption. Maya, the proof of the pudding is in the eating. In the case of EggHub Malawi and also for EggHub Ethiopia, producing eggs is just one part of the equation. It's when the consumers would want to eat those eggs, and when they eat those eggs, that's when the real success has been achieved. Could you share your insights into how you managed to secure thousands of customers for the EggHub in Malawi, and what role did social marketing play?
Thank you so much, Judith, and I'm grateful to be here to share. In the case of Malawi, and I'll bring here the private sector cap and explain how we managed to achieve success in high sales. The first thing any other private sector company would do if they were asked this question, and there was a question posed by our colleague from Nigeria, how do we ensure sustainability beyond that one test? We would have to create a campaign, you know, a marketing campaign that resonates with the prospective consumers, in this particular case, mothers, expectant mothers, and, you know, potentially families with children under 5. And how did we go about this? We went through, you know, understanding our market. We needed to appreciate who our consumers were. So we did a Know Your Customer assessment where we went and talked to different demographics in different villages across the impact areas where the hubs were. We wanted to appreciate what are the challenges that these households are going through in order for them not to consume. A lot of times we assume that it's because they don't have access to finances. In hindsight, they actually do. And I'm talking from Malawi, one of the poorest countries in Africa and the world, potentially. But what we realized, why people were not buying eggs for their children, they brought up different reasons that we as private sector never thought about in the first place. An example is that they said if a child was eating eggs, their hairs would not grow. Or alternatively, if it's an expectant mother who's also eating eggs, the child will be born with deformities. Now, how do you try and encourage or discourage or remove these myths from the prospective customer and ensure that they continuously consume the eggs to not only benefit their health, but the child's health as well? So after getting all this data, we worked with the Sight and Life team and designed different campaigns. How do we attract that consumer? How do we make sure that they understand why they need to eat this egg? And it was a long process. It took us quite a long time. And from business perspective, as private sector, I just want to sell my eggs today. But people are saying, no, we must get the right campaign so that we touch that customer properly. And yes, it does take time. That is something that we have to appreciate. But once that information is out there, once you design the campaign that is able to touch the hearts of the mother especially, it's very easy to then sell the egg. That's what we found on the ground. Now, we also needed to understand their diet. Again, what are people eating at home? We talked about eggs, and many people just know how to boil the egg. So the other thing we realized is, can we introduce different recipes that will also be exciting at household level? Things that we take for granted in rural areas, but in the cities, we're busy watching television. There's TV networks that you can be able to watch different food shows. I'm a big fan of MasterChef Australia, for example. So I'm busy trying to look for different recipes. And I thought, why can't we do the same for the people in the rural areas? So introducing the eggs in a completely different scenario, aside from what is typically known as the boiled egg, was something that nobody had ever thought about. And we looked at what are people cooking daily, and it's mostly, in Malawi, it's mostly vegetables. We said, can you just add one egg inside your vegetable? That's all you need to do to just uplift that meal at the household level. The children will be able to eat it, so will the husbands, and also the mother, and everybody benefits at the end of the day. So that made a very big impact. And then lastly, I want to mention the purchase location. So as much as you can have all these EggHubs everywhere, you need to ensure availability. Not many people have the capacity to travel to one particular EggHub, but those eggs can be brought closer to them. And this is where there was a the situation, what the doctor was saying here, can we ensure there is availability through vendors? So supporting vendors across the different areas where we're doing the marketing campaigns by putting posters, creating awareness on local availability, and also putting them in touch with locations where these hubs were located, made it that much easier for the consumer to access the egg beyond the location of where the hub is. And we talked about how do we continuously encourage people, especially in this case, expectant mothers and mothers and children under 5, to make sure that they continue to eat. We've already mentioned here, I think I'm the only one in private sector, but I will tell you this for the first time. Probably it's not something here all the time, but I feel that working with government is very, very important. Because for us in Malawi, in the case of Malawi, having the government buy-in really helped us market our eggs much more clearly, much more transparently. We were not just a private sector coming into rural areas trying to make money. We were actually coming together with the government to try and improve the health of the household. So trying to do this on our own would have been a big feat, but doing it together with the government structures, in this particular case, social workers or health workers, as the picture was shown there in Lima, the mothers were basically getting information from the social or the health workers in that particular case. We have that in Malawi. So we used that model as well, where the health workers go house to house to give advice to mothers, to children under 5. And these structures are available to be used by private sector for free. And there's nothing greater than free marketing as private sector. So we jumped on board on that. And until today, this is the one avenue that I believe pushed a lot of information to the local people in the rural areas where we are working in, to jump or to basically increase the uptake beyond what we have done as hard work creating these beautiful marketing campaigns. Just that government buy-in, that social worker going and testifying that, yes, if your child eats an egg today, they will have a better health. Thank you.
Thank you so much, Maya. You brought out so many insightful nuggets. I want to go back once again to Dr. Sise and, bring up that connection between what Maya talked about, private sector, NGOs, and also the government. But before that, I would like to also nudge the audience to please prepare your questions. So you will have about 5 to 7 minutes to ask questions. And for participants joining virtually as well, you can open the program in the app, select the session. It's Saving Lives and Livelihoods. And click on the interactive features panel, and then you can ask the questions. You can type the questions, and it will come on the iPad with which I will use to ask the panelists the questions. Dr. Sise, that brings me to you. What role do you think NGOs and donors can further play in supporting government efforts and policies like yours?
Yeah, thank you so much. I think, when we look at egg at community level, from where I stand, from the Sakota Declaration perspective, at community level, egg is food and also income. So I think one thing that NGOs could play is a lot of education has to be made in terms of promoting egg as a food. Especially if you look at the dietary diversity score for Ethiopia, both for pregnant women and also children under 2, is very, very low. Especially the animal food component is very low. So I think considering the ease of production of egg at household level in the schools, having a very consistent and also strong message in terms of egg to be consumed at household level is something which the NGOs and also donors could support. The second part is from Sakota Declaration experience, we distribute, nearly like, millions of poultry in a year in 240 waradas. But one of the critical challenges is feed. To increase productivity of egg, feed is a critical component at household level. So I think NGOs and also the donor community, how could we promote a community-based feed production system so that householders could access feed from their neighborhood? Because in Ethiopia case, it is the major towns are the ones that really produce feed. In remote areas where the Sakota Declaration is being implemented, once the supply of feed has finished from the government or our development partners, the subsequent feed access is a challenge for the household. So I think creating community-based poultry food feed system is very critical. The third is, I think, the vet service. When the poultry gets sick, in one household, because we have a household package as well as also a school package, sometimes a number of poultry will die in a very short period of time. So strengthening the vet service and also providing that access is very critical. And in areas where we have already implemented over 2 years, now households have a lot of demand for poultry production and also egg utilization at household level. But the replacement rate after 2 years, the productivity of the poultry will go down so that they can't get as adequate egg as they should get in the previous period. So I think the cooperative, I think the model that you showed us, for instance, if we organize cooperatives of youth, cooperatives of women, so that they can produce the 1-day-old chicken to 45 days or 90 days so that they can avail the replacement of the poultry closer to the household. When the older poultry reach 2 years, their productivity will drop down in terms of the number of eggs they produce for the household. So the replacement strategy could be supported by NGOs as well as also the donors. I think finally is in terms of supporting the existing policies, the existing models. For instance, we have a household package, and also we have the model school, the model nutrition school approach. So financing such kind of package from NGOs and from the donors will help really to accelerate the poultry production and also access to egg to the household level in considering the Sakota Declaration experience. Thank you.
Thank you so much, Dr. Sise. What I'm hearing in this panel really is how the policy, what Dr. Sise mentioned in the Sakota Declaration, what is really required is also the sustainability and making sure that NGOs and partners and implementers come together. And what I'm hearing from Yetnayet and Maya is how implementers and, in terms of marketing, how it's so important to be able to create those synergies with the community health workers and also the policymakers. So really to create synergies, it's really important for the policymakers and the implementers to come together. So that's my key takeaway. But I'll also see if anybody in the room has any questions. Please feel free to come in front of the mic.
Hi, Hannah Fraser from the UK. Thank you. Really interesting talks. I can see greatly the health benefits of increasing egg production and consumption. I just wondered for the EggHub project, as you're starting these poultry farms, have you been able to embed any environmental sustainability considerations? I don't know, there are obviously challenges with that, but I'm just thinking in terms of the feed for the chickens, like you mentioned, producing local feed, the energy and water use, the recycling of manures, things like that.
I can take the first stab at that, and then Maya and Yetnayet feel free to jump in. Biosecurity and environmental sustainability is something that the EggHub really considers seriously. For example, we have a 42 biosecurity checklist that we have with the farmers when they are constructing the house, at what distance each of the poultry farms should be, what are the biosecurity clothing procedures and all of that. So there is a 42-point checklist that all farmers should have to continuously adhere to be able to ensure that biosecurity is and also the sustainability is definitely adhered to. Maya and Yetnayet.
Thank you. I will touch on the question of, specifically on the manure as well. The good thing is in Africa, manure is in high demand. In fact, it is highly coveted. So you'd find that as the farmer is constantly clearing out their chicken coop, the manure is already pre-sold in advance because a big majority of Malawians, and I'm sure it will resonate in most African countries, rely on agriculture as well. And we do encourage using the manure. It's actually a very good high source of nutrition for any kind of planting. So we do not have any waste that is thrown, for example, that would litter. Besides that, from the feed perspective, because the manufacturing process of animal feeds is normally using of discarded or unwanted crops. We talk about rice brands, the things that you will not necessarily use and throw away is what we encourage farmers and any feed mill to use as the process of manufacturing feeds. So we do not want feed mills to be competing with animal or human food. We want them to be consuming only crops that are ideal for animals. So mostly brands is what goes into the animal feeds. We will also have, instances where you use maize bran as well, or sorghum, depending on the different types of farms that are and the location, because every country has different staples that are present. Majority of the feed is manufactured with things that are discarded in the process of making human-grade food.
Thank you, Maya. Please go ahead.
I think she has just answered my question. Because I think my question, Busima Zia is my name from Nigeria. My question was, I did see in the hub the feed mill, but then I was wondering where are the ingredients which go to the feed mill? Who supplies those ingredients into the feed mill? Now you are saying it is the byproducts of the other processing processes. but then are the quantities enough? And what is the quality of the egg afterwards? Have we looked at that, especially the amino acid composition and vitamin composition? Because we are now using byproducts, and doesn't this increase the cost of supplementing the feed so that it has the nutrients to make the chickens grow? Thank you.
Maya, do you want? Yeah, please go ahead.
No, that's a very good question. If you're working in a proper feed mill, we do encourage using different supplements. So the question of will we negate the amino acids and so forth is not necessarily a big issue, because you can buy these nutrients as a pack. The feed mill in Malawi specifically is using DSM nutrients. And then from there, you're basically able to create the perfect feed based on the amino acids and all the other nutrients that come into the pack. Now, because we live in a country that different products come and go, that's a very good question. Do we have enough byproducts? The answer is yes. And the good thing is, because things come seasonally, for example, we have maize that comes first, and then later the rice is harvested, and thereafter we have other different byproducts that come in place. You're able to play around with the formula of the feed. So the feed formula doesn't have to be the same from day 1 up to day 365. It can change based on what's available at the time. And pricing, therefore, is also able to be balanced to make it affordable for the farmer. I hope that answers the question.
Yes. Dr. Sise.
Yeah, I think I want to add on the feed side, because big cities, big factories, they can make it. But my call for action from this panel is, how can we make a sustainable feed supply system at community level so that we can provide access to households and schools like we do in the model nutrition schools. I think that is the most critical thing we need to take. Thank you.
Thank you. And I think that's really where the EggHub comes with, they aggregate, provide, customize the feed in a way that's required for somebody who's only having 1,000 birds or even 20,000 birds. They're able to do that, and that's a great model. Thank you. Probably we'll take 2 questions together, and then we can pose them to the panelists. Yeah, thank you.
Thank you. I'm Tigis from Ethiopia. One of the questions is a question already raised by Dr. Sisai, how we are sustainably have the chicken feed at local. This is the first question. And the second one is about chicken sourcing. And still the chicken needs replacement beyond the NGO and the government policy environment change. Is there anything which is seen as a sourcing internally, in country? If there is anything happened in the supply chain, what is going to be the sourcing internally? If there is anything already planned to replace those, the one who is old, and this is from the chicken side. Yeah. And the third question is for Dr. Sisai about the school garden in the school chicken production. Who is going to involve in that? Is that student? If the students are the one who are working there, what about the child labor issue? And is there any, if there is shift even in their education, if they shift from education focus, and what will happen in their performance as well? And also, what is the compensation mechanism for them? Thank you.
Thank you, Tigist. We'll have the next question.
Thank you for the presentation. My name is Kiruko Lialauba from Imo State University, Nigeria. So thank you. The presentation was really nice. Introducing egg in household meals is actually a good one, but I think is somehow difficult to achieve, especially in societies that believe that eating egg is for the rich and high-income earners. So my question here is, how did you actually get the government to support in financing the supply of egg in the rural areas at a reduced or even no cost? Thank you.
Thank you. Thank you. Let's start with Tiggy's question. The first part of the question, if I got it right, was how do we replace the chickens that have already been used? Maybe at night you can pick that question from your experience.
Yeah. Yes, I think you raised a critical question, particularly for Ethiopia. Sourcing feed and the day-old chicken is a challenge across the country. So with this EggHub model, what we are trying to do is, working with the field millers that have a capacity to process feed and provide with a smaller package, to rural small-scale producers. So, and how to reduce the cost by helping, the feed miller in terms of changing the feed mix based on the available, source at that time, and also by increasing the storage capacity of the feed millers, to buy and stock during harvest time, to control the price of the feed. And also using, in another example, is trying, a feed franchising model, so that you can be closer, to the smallholders or to rural areas which are located far away, from the big cities. And similarly with the day-old chicken, that's also one of the logics for the EggHub operator, sourcing the day-old, we are working with those private sectors that have a capacity, to source the parent stock so that they can produce the day-old chicken and also keep them until, for 2 months, 60 days, so that they are ready and build disease resistant, and by the time they go to the farmers, they will be ready to start laying eggs. So by combining different private sectors at different levels with different capacity, we are trying to address the issue. But at the same time, policy intervention is very important. How can we sustainably import, the parent stocks? How can we have, the source in country, and also addressing the feed issue, the taxation issue? All these come, at policy level, and we need to dialogue and work together with the government to address all these issues together.
Thank you. Thank you, Yetnat. Yes, please.
Okay, wanted to clarify a couple of points that were both raised by Tegust and Kerry. So in terms of replacing the chicks and also the government supporting the rural communities in accessing eggs, I think the whole point revolves around the market-based approach. And for us, this is purely market-based, and the government does not provide any funding for this. The role of the government is mainly to shape the enabling environment. And our role in terms of catalytic funding and supporting the EggHub mainly goes to the revolving fund. So we did not have the chance to go into the details of what's included in the model. So there is a revolving fund that covers cost of certain initial inputs, but then by the time the chicks need to be replaced, the farmers themselves have made enough profit to buy the replacement chicks. So it all involves around the model, which is market-based, and the catalytic funding fits into or plugs into the requirements for the initial stage. So this would, I guess, clarify the concerns, but feel free to jump in and have this chat following the panel discussion. We'd be more than happy to give you a deep dive. Back to you, Srijit.
Thank you so much, Tariq. Dr. Sese, the question about school gardening and school farming, would you like to address that?
Yeah, I think school gardening is part of, in Ethiopia, and it's part of the school curriculum. And usually it is a demonstration garden. But when it comes to for the school feeding and also for the poultry, I think poultry, as you know, is very sensitive, and we need to protect from frequent human contact. So in that case, all the schools, they hire either volunteers with part-time workers, or a dedicated staff will be assigned, and teachers will be responsible for managing the program. But for school gardening, it's part of the school curriculum activities where children learn by doing, and they will have their own portion plots. They will do a kind of exercise, but at the same time, with volunteers that will be supporting the school gardening, they will harvest and put into their school feeding program. Maybe one thing, maybe the last question related to the egg for rich people. I think that is what I said at the beginning. You know, egg is a food as well as also income. So most rural community people, even where we do the Sakota Declaration, they want to sell than to eat. So that is where we need a lot of social behavior change communication. And you know, the householders to recognize that this is important for them, this is important for the children, and they need to prioritize their family. And then the leftover, because in Ethiopia the package has 3 components. One is consumption component, the other one is the saving component, and the other one is also the selling and the bringing income. So when we give them the package of poultries, we also, and also the days rate is also considered. So that is also within the package of the poultry that will be provided for the households. Thank you.
Okay. Thank you, Dr. Sise. With that, we are coming to the conclusion of the panel, and I'd like to invite Dr. Kalpana Bisabatani, who's the Managing Director of Sight and Life, to please do the closing remarks.
Thank you, Sujit. I would like to share a couple of key takeaways from today's presentations and the panel. First, from Dr. Nelly's, the evidence on eggs is very clear, especially this evidence from Peru reminds us that we are dealing with a much larger problem here. That lets me ask 2 questions. So what is the significance of the study and what is the relevance of the study? The first, the significance of the study is that the kids in the control group who are falling further behind the WHO growth standards, they're likely to experience stunted growth, which means they're very likely to be stunted if we keep modeling beyond those 11 months of age, but they will be stunted by the age they are 2 years old. And the relevance of the study lies in the fact that a staggering about 1 in 3 children are directly affected. So then we ask the question, should our larger goal be just meeting the WHO standards of stunting? It cannot be, because we must be saving all children who are showing stunted growth velocity. The worst off does not mean we ignore those who are slightly better than them, but still very poorly off. So as a community, we must certainly aim higher. Then we heard a very pertinent question from the audience. How do we ensure sustainability? And we need sustainable models. We saw that the EggHub model is one such model. It can make a difference, and it already is, both lives and livelihoods, where Dr. Sise was talking about. And the need for providing staying power to projects is most important, and we need time to show that kind of impact, is what we heard from Patricia. And local partnerships are very important, and so is scaling up with government collaboration. So we thank the government of Ethiopia, specifically the Ministry of Health, for the guidance and support. And finally, there is no good producing nutrition if there are no takers of nutrition. So what Maya was referring to is the role of social marketing and raising awareness that cannot be undermined, because more demand not only leads to good business for farmers, but it's a win-win all around for healthy babies and mothers. So what today's panelists and presenters have shown is what strong collaboration looks like, that I'm reminded of these wise words. Coming together is a beginning, keeping together is progress, but working together is success. Thank you so much for your time and effort.
Thank you so much for joining us today, and we are here. If you want to catch us right after the session, please feel free to. We're more than happy to interact with you. Thank you so much.